Jeff. Thank you very much. Good afternoon, everyone. I'm your last speaker this afternoon. And today I'm just going to take you through the journey through mouthguard fabrication, how we do it here at Aspetar. And like everyone else, I have no actual potential conflict of interest in relation to this presentation, and most definitely will not be discussing any off-label or unapproved use of drugs or products in this presentation. I think I prefer to use this one. Our learning objectives today in my presentation is that we hope you'll be able to distinguish between a custom-made mouthguard and a boil and bite. And I hope to summarize the importance of taking a proper or a perfect impression. And I'd like to explain also how to fabricate the perfect mouthguard using a simple articulator. I've got just a few comments here. One is from the current president of the American Academy for Sports Dentistry. And Dr. Brick, he says, over the past year, we've seen incidents of trauma to the oral cavity that could have been mitigated by the use of a proper fitted mouthguard, even in sports that are not typically viewed as contact sports. I think it's good if we can better publicize these cases to the general public. And this is where the education is coming in. And this is why Dr. Mohammed thought it was a good idea to get this message out. And again, also on their website, the American Academy of Sports Dentistry, it says a mouthguard made by a dental profession can also tailor the mouthguard to the demands of the athlete and the sport. Speech requirements, individual occlusal differences, and relative dental and a concussion injury risk of each sport can only be customized by fabricating an individual mouthguard. It is difficult to see how an over-the-counter mouthguard can fill all an athlete's requirements without being checked and adjusted by an informed dental professional. My topics today are about the types of mouthguard. I'll also be discussing why it is recommended and we recommend here at Aspetar and do the custom-made mouthguards. And also, what about the dentition? A lot of people are asking, and a lot of patients ask us, I have braces, can I get a mouthguard? I have some missing teeth, can I still get a mouthguard? My teeth are not straight, can I still get a mouthguard? And how long does a mouthguard last? The different types of mouthguard we have here, I'm just going to run through them briefly and touch on just a few of them after this slide. And here we have the boil and bite mouthguard. That says it all. You pretty much boil and bite into it. We have the double mouthguard, and that's just a mouthguard that has a mandibular and a maxillary side to it. You cannot usually speak with this mouthguard, okay? So usually, typically, sometimes in American football, if they're not getting it custom made, they might wear something like this, but it's illegal in America anyway. And then we have the custom fit mouthguard, which is the king of them all, and this is what we do here. And we have the vertical force mouthguard. And someone had a question this morning as to if an athlete has to deal with stress. Well, this is the one that's the reason that they usually publicize this guard. And I wouldn't call it a mouthguard, but this is one of their, basically when they advertise it, that's what they advertise, that it helps to deal with the posterior area if the patient or the athlete is very tense during their performance. Okay, so that's how they promote that one. And then we have the mouthguard for braces. Yes, we also do that here. And then the lip protector mouthguard. Now, from the literature that I read, these mouthguard are basically just for show because they can come quite decorative. Okay, so you can have some that look like a monster or what we call in America with all the gold teeth, jacked up grill. So it can also look like that. But today we're just going to talk about this one and this one and this one. Okay, and some other store-bought. Okay, now a stock mouth guard is basically just as it says, it's a stock mouth guard. It's usually found in sports stores and some pharmacy. It's easily available. usually made of rubber or polyvinyl chloride or polyvinyl acetate. It's not expensive, so that's a quick fix for a lot of people. I think when I looked on places like Amazon, you could get them for like $4, so they're quite inexpensive. And they come in limited sizes, so if you get an athlete who has a very nice jawline or something, he may not be able to get something like that. It probably won't fit him very well. Again, it doesn't fit very well because basically you're just going in the store, picking it off the shelf and trying to put it in your mouth. And it inhibits your speech and your breathing. Now the boil and bite mouth guard, quite popular, but it's not recommended. It's made of thermoplastic material. And basically what you're going to do is you're going to put it in some boiled water for 10 to 45 seconds, and then you're going to try to adapt it to your teeth. Now, you know, to me or to anyone else, if you just take a good look at that, I'm not sure if you want to be playing with hot water and then trying to get that in your mouth as fast as possible while that material is still soft from the heat. You know, a lot of things could happen there, and then if you get it wrong, you'll be there all day trying to get that right. So again, it's not expensive, $14 I saw on Amazon as well, but it just does not give that full protection that they require. And it also tends to affect the speech and the breathing. Now the custom-made mouthguard, which is what we fabricate here at Aspetar, it's the #1 recommended. It's made to fit an individual patient, so there's no sharing. I once saw a video where the guy just loaned the other guy his mouthguard to go and play. You can't do that with a custom-made mouthguard. Okay, it's made of thermoplastic polymer, and our material comes directly from Germany. So, and it also allows for normal breathing and speech because it's obviously made for that person. Okay, and it differs in thickness by sport, so I wouldn't custom made a mouthguard for a boxer the same size, same millimeter as I would for someone who's playing football, all right, or basketball. And it can be customized by color and design. However, the drawback for most people is that it's expensive. It can be expensive. And one thing that's important to me is, please, it's not a night guard, okay? It's not the same thing as a night guard. Now, a custom-made mouthguard as well can be made for your children or small children as early as they start playing sports. It is highly recommended because, you know, the children, they're still developing and they tend to get a lot more trauma. They fall a lot more than, let's say, your grown athletes. So they fall and, you know, all that other stuff. Now, the mouthguard for braces, they achieve the same protection as people who are not wearing braces. And Dr. Mohammed also told me, and I did read up on it, that these athletes with braces are at a greater risk for fractures. And most of you doctors can tell the wires, everything is attached, so instead of one tooth, it could probably take 4 of them with them as well. So then they're fabricated with more room, okay, to allow the athlete to be able to remove it and to put it back on without affecting the current treatment that they're undergoing with the braces. The manipulation, the key in doing these type of mouth guards here is the manipulation of the alginate, okay, when removing that alginate from the patient's mouth and the pouring of that study model. And we happen to have a staff here that's very, very good in getting that pouring up to par. She's very good. Now, how long do mouth guards last? Well, it depends on 3 factors, really. And one of them is how often is it being used? You know, like with most things, like he just mentioned, Daniel just mentioned that, you know, if someone is just exercising in the gym for 5 minutes, you know, it's not the same as someone who's, you know, playing football the entire season or playing basketball or being a boxer. So it just depends on how often it is being used. How do they take care of those appliances? We do give them instructions before we give them the mouth guard, and we also give them a booklet to take home, and we do reiterate those instructions before they leave our clinic. So it's very important. and the quality and thickness of the mouthguard. I'm not sure, but here we follow the American Dental Association, sports dentistry, on the thickness, on the quality of the mouthguard material that we use here. So, you know, if you get a mouthguard like a boil and bite, I don't know what to tell you because I have no experience with those type of mouthguards. But from our athletes, we find that things have been going very well in terms of the quality of the material that we use. I'm going to show you a video of how we fabricate. I'm going to take you through the journey of how we custom made our mouthguards here at Aspetar. Before we even start thinking about taking an impression, we do a clinical exam externally, and as you will see in just a moment, Dr. Mohammed is checking, and then we do one internally, just in case something has changed since the last time we saw that patient and they requested an appointment to have a mouthguard. We're also checking to see if there's any food debris on the teeth before we take those impressions, because anything can compromise the integrity of the impression, the alginate impression. We go ahead, we try our trays in, make sure we have the correct size for that patient. It cannot be too big and most definitely cannot be too small. We take 2 impressions here. We take an upper and a lower. And one of the reasons why we do that, I'll just stop that for a second. One of the reasons why we do that is so that we can capture the entire dentition of that patient. Because in the old days, to do it a little bit faster, and it's probably still done, is that you would take an upper impression, you custom made, you know, that for the upper, and then you'd use fire, go around, and you'd have the patient bite down. But from experience, and a lot of doctors are here, and you know this, that sometimes when you even ask them to bite on the articulating paper, they never usually get it right all the time. They shift or they bite anteriorly, and that can also affect how they will occlude on that material while it is still warm. So we do take 2 impressions. Spatulation, very, very important. It's the beginning of the process. You want to have an homogeneous mix. Can't have any lumps. Again, it will compromise the integrity of that alginate impression that you'll take. Remove any excess from the palate, which is quite normal for any alginate impression. It doesn't go down the patient's throat. And here you see the doctor massaging the upper lip, and that's to get the identity of the vestibule. We need that. We need that. We need to be able to, if you look here, we need to see that integrity. It's nice and it's beautiful. We've got the frenum here and everything just looks gorgeous. And you can see here the dentition on the occlusal surface of that patient. It's really nice. For the mandible, we also just need to capture the occlusal surface. Now, most of you who are pouring or lab technician, here you are, we're just go ahead and I've got the machine on a low speed because I need to make sure that I'm not rushing this first layer. Because what can happen is if you try to put too much at once, you will have not captured some of the cusp. It will just flow right over those cusps, and then you'll have bubbles, huge bubbles. We usually wait about 24 hours for it to dry. We soak it when we get it, and then we go ahead and we trim. Now we custom made our mouth guards to the first molar only. So we trim all the other teeth off. We only go to the first molar. This is recommended, and that's what we do here. You have to be very careful when you're trimming, so you don't compromise the integrity of your model. You don't get any of the facial, so you have to be very careful and go slowly. Do the same for the mandibular, also to the first molar. And you might say, what if they don't have one? Good, we'll just go to the second molar, and there's still that space. We go ahead and remove any excess, any bubbles. We clean up that model, again, not to compromise our appliance. This is our material that we use. This happens to be a clear material. This is a 3 millimeter. Now we do 3 layers here in Aspetar. 3 layers, we lay down 3 layers. Our first layer is our 1.5. And we find that the 1.5, it tends to captures that anatomy very, very well because it's such a thin material. So our first layer captures that anatomy, which will give us that nice fit that we're looking for, that comfort that we're looking for. And also, why we also start out with the first layer of a 1.5 is we can also check it to see if there are any bubbles, if there's anything on our cast that we might need to remove or we might need to fix. Do we have a bubble that we need to get some alginate, not some alginate, but some composite, and we might want to correct that before we go ahead and make the entire appliance. And there's our first cast. Now we take out for the frenum, and if you look at it, that anatomy that we were talking about earlier, we've managed to capture that anatomy of that patient. So that's really nice. So it will fit that patient. We go ahead and we trim it up, get it all nice and smooth. We reduce the palatal as well to enable them to speak and breathe. Clear is not the only color that we do here. We do several different colors. Patient is back in. We go ahead and we check for a fit. We examine by the vestibule, make sure nothing is being impeded. There's comfort. We allow the patient to put the appliance in so he has an understanding of how to put it in and how to remove it, and if he's comfortable doing that. So we remove it, both sides, click, click. We give them some instructions how to take care of that mouth guard. Brush it every time you wear it, okay? Give them a container. Make sure you do not put it in the container while it's wet and close that container because then it will smell. Do not leave it in the car, for example, in this heat, or do not place it near heat. And then we also give them our take-home instructions. Oops. Jabs, help me, please. Yeah, I need to get to my next slide, sorry. Okay, great, sorry, thank you. I think this will work for me. Now, a little bit about our story here at Aspetar. We fabricated over 1,800 custom-made mouth guards here at Aspetar so far, and we fabricate for various disciplines in sport. And we've had the privilege to fabricate in the past for various other teams in the Gulf, but now we've limited our services to only athletes registered here at Aspetar. And again, we fabricate according to sport. We wouldn't give a boxer, again, the mouth guard of a basketball player. We wouldn't give him the same size. And we also do color. So a lot of our athletes, they want the colors of their flag. We have the capability to do that. Or they just want a specific color. And in 2015, we invited the Director of Sports Dentistry of Eastman Institute in the UK. And he noted he was surprised at our technique and how it correlates with how they did it at Eastman. Any questions?
Perfect. So, moving on to questions. Gentleman in the blue top, can you just wait for the microphone, please?
Thank you so much. Just my question about the thickness. It's one layer 3 millimeter or 2 layers, every layer 1.5 millimeter?
Oh, that's a great question. Our first layer is a 1.5, and then our 2 consecutive layers are 3 millimeters. And why we do that is once you put the heat to the first layer, the 1.5, it compromises the integrity of the size. It's no longer a 1.5 after it's thermoformed. And then also we find that the same thing happens to the 3 millimeter, obviously. So when we do 2 layers of 3 millimeter, we have the thickness that we can work with. Like, let's say one of our athletes bites too much in the back. We can work with all that.
But both layers the same material?
The last 2 layers, the same measurement. The first layer is 1.5. It just captures the anatomy so well.
Thank you.
Welcome.
Any further questions? Gentleman in the white top. Can you speak louder, then we don't need to get the mic?
Yes, please. Do you have a photo for braces, mouth guard?
For the braces mouth guard? No, I'm sorry. I'm sorry, we don't have a photo for that with us today. But basically, just to explain it to you, on the inside where the bracket is, okay, we go ahead and we kind of block that out with wax. So we put wax all over the bracket. And that leaves that room, that space for the braces.
And also you make the 2 layers together in the same time, or?
No, each layer is adapted separately. So first, a 1.5 millimeter, and then we go ahead and we do our 2 consecutive layers of 3 millimeter. The same material. Pardon me? No, they're all one. The first layer is a 1.5 millimeter. Yes, the second layer is 3 millimeters, and then our third layer is also 3 millimeters.
And you fabricate it in 3 times?
3 times, yes.
Thank you.
Sorry? No, it doesn't come to 7.5. It comes much thinner because you've had it eat. So it's no longer, the integrity of that 1.5 has been totally compromised. It can no longer be a 1.5 because now it's conforming to our cast. So it's no longer, believe it or not, it's no longer 1.5.
Need any bonding material between the layers?
Bonding material?
Yeah.
On the cast?
Between the layers.
Oh, no. Because it's, first of all, let me just go back a bit, sorry, and I'll show you something. Oh, it will be in the video. How much time do we have? Yeah, okay, it's kind of in the video. I'll just show you something. Because each layer has a different time. Now, our machine might be different from the machines that you use in your own lab or that they use in another lab. Where's Japs? How do I forward this a bit? Oh, I can't forward this. Sorry about that. He just told me there's no way right now to do that. But we set our machine, we set our Thermoform machine to different timings for each layer. So for our 1.5, I think it's 105, 1 minute and like 5 seconds. And then for our 3 millimeters, we set it for 1.5. So each layer gets the heat for 1.5. And as most of you know, with the cast, you cannot make that base too high, because then it's just too high for that vacuum form to really, really work well. So depending on how your base is, that will let that machine come down and just nicely attach to that. Okay? So that's why I'm saying it's no longer a 1.5, it's no longer a 3 millimeter, because it has been compromised, it has been stretched to come right over that cast. And the more layer you put, you know, the more stretching it gets, because we also need that to get down into the vestibule area, because we also need that to be the same size.
Any further questions?
Is it soft or semi-soft or hard?
Well, it's not soft and it's not too hard, but it's the right amount of protection that is recommended by the associations that deal with sports dentistry. They recommend that our end product is 3 millimeters. Our end product needs to be 3 millimeters for your normal sports. And if you're playing boxing, it can be up to 4 millimeters and 4.5 millimeters. And that gives you the type of protection.
But with your 3 layer, it will be total 4.5.
No, we then adjust it, as you saw in our video. Because we also, what I may have failed to mention is that we articulate. We articulate, and I did mention it. We articulate, and that's why we take an upper and a lower. Yes, we do use the articulator, because it's a good point. Because the thing is, if you just make it on its own, like you just make the upper by itself, what you can find, and you're probably a doctor, a dentist, is that your patient, they never really bite down according to their normal bite. When you tell them to bite down, they tend to adjust somehow. They'll or like this, you know. And so the old way, and we choose not to do it that way, and some people still do it, is we use fire. We put fire on the occlusal, and then we tell them to bite, and then we hope to get their dentition, okay? But then if they bite off like this, or they shift, you know, we're in a mess. So we prefer to articulate, and so when the patient comes in, we don't have a lot of adjustment to do. We just don't, because we already have the frenum. We leave enough room. Dr. Mohammed checks it, and so by the time that patient comes in, it goes right in, pops right in. Yeah, welcome.
Any further questions? Thank you very much, Esther. Great.
Thank you very much.